Hello, my name is Hannah. This is my Indwelling urinary catheter insertion and removal demonstration. Before I get started with my demo, I wanted to go ahead and kind of explain the setup that I'm going to be using. So to mimic my bladder and urethra, I went ahead and took a Coke bottle, um, cut a straw in half, and then hot glued the end to try to mimic the um, urinary meatus as closely as possible. So this is going to be my patient. I'm going to tape it down so it doesn't go everywhere. Go ahead and cover my patient. All right, and I'm going to go ahead and get started with my demo. Hello, my name is Hannah. I'm a UWF nursing student, and today I need to insert a indwelling urinary catheter. Is that all right with you? Okay. Can you please state your name and date of birth for me? Okay, great. Do you have any allergies to betadine or latex? Um, I'm going to go ahead and verify the order for the indwelling catheter, making sure that the provider also doesn't want me to get a urine specimen. I'm going to wash my hands. I'm going to go ahead and raise the bed to my waist height and then raise the side rails on the side where I'm not working with the patient. I'm going to close the door and curtain for patient privacy. So Mrs. Kidney, today I'm going to be inserting an indwelling urinary catheter. Just to tell you a little bit more about this procedure is I am going to need to expose your pubic area, and this procedure entails that I take a small flexible tube. I'm going to insert it into the urethra and into the bladder. So you're going to feel some pressure when I do this. Is that okay? Okay. So now I'm going to go ahead and start getting ready to do my peri-care, my gloves, my non-sterile gloves. Okay, Mrs. Kidney, I am going to go ahead and expose you, okay? Okay, and what I am going to need you to do is I'm going to need you to, I'm going to move your legs apart, and I need you to flex your leg at the knee with both legs. So this is me putting the patient in the dorsal recumbent position. So now I'm going to do my peri-care. I've got my bowl of soapy water here and my clean washcloth. Okay. I'm going to start with the labia majora. Do fresh side. The other side of the labia majora, the labia minora. And then for my final swipe, I'm going to go from the clitoris over the urinary meatus down to the anus. I'm going to place this aside so I have more room. I have a trash can down here. Remove these. Wash my hands again. And now I'm going to go ahead and get my Foley bag, place it in between the patient's knees. I'm going to put my Foley bag at the end of my patient's bed to be used as a trash can. Now I'm going to be putting on my sterile gloves. My right hand is my dominant hand, so I'm going to start with putting on that glove. Okay. And my fingers got caught, so now I'm going to, now that I have my right sterile glove on, I'm going to fix my glove. Okay, so I don't need this anymore, so it's going to go in my garbage. All right, so now I'm going to apply my sterile underpad. I don't need the fenestrated drape. Put shiny to the hiney. Okay, Mrs. Kidney, can you go ahead and lift your bottom for me? Okay. So now I'm going to start getting ready to do my, use my beta. Put my betadine aside. Put my forceps near my cotton ball. I'm going to set my urinary specimen collection aside. I'm going to, now I can go ahead and pour my solution over my cotton balls. All right, now I am going to go ahead and set my Foley catheter close to my patient, keeping it within my sterile field. I'm going to squeeze my lubricant into the corner of the container to get it ready. I'm going to attach my syringe to my balloon port. And my drape is already pretty close to the patient, but if it wasn't, then I would drag it closer. Okay, Mrs. Kidney, I'm gonna go ahead and touch you now, okay? So my left is my non-dominant hand. Again, wiping labia majora. Labia minora. Labia minora. And then down my final swipe from the clitoris over the urinary meatus down to the anus. Okay, now I'm going to go ahead and lubricate my catheter. About 2 to 3 inches from the tip. Okay, Mrs. Kinney, what I need you to do is bear down and like you're going to urinate, and I'm going to go ahead and insert the catheter now. You're going to feel some pressure, all right? Just go ahead and bear down. I'm going to start about 2 to 3 inches or until I see urine flow. So let's say I've seen urine flow, I'm going to insert another 2 inches to make sure it is in. Now I'm going to hold my catheter, go ahead and insert about 5 ml or 5 ml of water to inflate my balloon. Okay, I'm going to go ahead and move my syringe. All right, so I have got resistance. I'm going to go ahead and remove my sterile gloves. Now I'm going to go ahead and put on a pair of non-sterile gloves. Sorry, my hands are so sweaty. Okay. All right, so now I'm going to go ahead and this catheter bag gets attached to the side of the bed, so I would go ahead and hang it on the side of the bed, and I would probably put a towel or something to cover the bag so the urine isn't showing, just to protect the patient's privacy. If it is attached to the thigh, then I would have already had the thigh strap on, and I would attach it to the bag using the adhesive. So it's attached to the side of the bed. I'm going to go ahead and discard of my supply, the rest of my supplies. Then at this point, I would cleanse the perineal area again with a clean washcloth, a different washcloth, obviously. Making sure there's no betadine left, because that could irritate their skin. Then I would recover the patient, return the bed to the original height, lower the side rails, ask the patient if they are comfortable and if they need anything, and if they have any need, and make sure they have the call bell. So when I go to document what I did for insertion, I would do the date and time, the type of catheter, the catheter patency, what did the urine look like, did it have a smell, was the patient alert and oriented during this procedure, what the skin looked like on the abdomen and in the perineum, any patient family teaching I did, and the patient's response, did they tolerate well, not tolerate well. And so now I'm going to go ahead and do my removal. And so I'd come in, I'd perform hand hygiene, I would do all my critical elements, and I would don uh, a new pair of gloves for the sake of the time of this video. I'm not going to do that because my hands are so sweaty, so I'm going to, if it was attached to their thigh, I would take an alcohol pad, rub it, remove the adhesive device, and remove the catheter bag. Now with a clean, then I would go say, okay, Miss Kinney, I'm going to go ahead and expose you, perform my peri-care, take a new syringe and deflate my balloon. And then I'm going to say, okay, Mrs. Kidney, go ahead and exhale for me while I remove the catheter. Okay, my catheter is removed. This would be garbage. Again, I would perform my peri-care, recover the patient, make sure they're good, they don't need anything, that they're not in any pain, and that they have their call bell. I would remove my gloves and perform hand hygiene, and that is it.